Well, Dr. Stepovich, we know you're an orthodontist in San Jose, California, up there. But let me ask you something. We know that moms should bring their children to a dentist literally before they even have teeth sometimes, to just get used to the dentist, to just kind of like get the feeling of that dentistry isn't such an ugly, bad thing. And I'm sure you agree with that, or not. Do you?
I do. I certainly do. And I think one of the nicest things that happens in my practice is that when I treat adults, they bring their children with them, and they see, and their young children sometimes, and the children get to see their parents being treated with no distress at all, and we're talking, and I'm doing things, and they're opening their mouth, and I'm giving them instructions and things of that sort. And I've had little patients sit down in an empty chair and want me to examine them, want me to look in their mouth.
Sure.
So we do make good patients by seeing their parents or their sisters or brothers or even relatives, just by coming in and seeing what we do. And because orthodontics it should be very pleasant for the patient and the doctor and the staff. Right.
Okay. So now, to one of my main questions. So, and I'm glad you elaborated on this, that this is really good for the children. Now, when should, however, a mom or a parent be definitely saying it's time to really go to an orthodontist just to check to make sure that your teeth are coming out straight, that there's no problem, and that we can do the braces if we need some as fast as possible, or even maybe with a few, I don't know what that may be, type of dental work, prevent braces, or at least prevent, heavy braces work. Is there such a thing of like when one should go and get checked?
I always tell the moms, mothers have a great intuition about what's going on, and they want answers. And if they feel like, if they have a mother's intuition that there's something going on with their children's teeth, they shouldn't hesitate. They should come in and see an orthodontist or their general dentist. And normally the general dentist then will say, go see the orthodontist, because they'll know that there's something concerned. I've never found a parent that's brought a child in that didn't have anything to do. They have some reason for coming in to see an orthodontist. In fact, I always ask the children, when there's a child, or even an adult, I say, why are you coming to see an orthodontist? And they quickly give me a whole laundry list of things that they've been thinking about. And then we go from there.
Such as? What's that laundry list, by the way?
Well, they'll say, I don't like the position of these teeth. Look at my lower teeth. I don't like to smile and show my lower teeth. And and then one has a big shadow. It makes a big shadow for me. And when I look in the mirror, I don't like what I see. And I'd like to have that taken care of. And I tell them, yes, I agree with you. And we can take care of that and get these teeth to look like Hollywood teeth.
Well, all right. Now, let's assume, and it's wonderful to hear, it's really wonderful to hear that most moms, or all moms, as you may have said, have an intuition that things are going on, and then the child himself has an intuition of what's going on. But let's assume that intuition isn't there, and for some reason it looks like it's all fine and dandy. When should a mom bring the child to the orthodontist to make sure that things are fine?
Well, the American Association of Orthodontists recommends 7 years old. Because
do you agree with them, though? Never mind what they say. What do you say?
I say that I've treated patients at 3 years old, and they have no permanent teeth at all. And we change things so the child can develop in a more normal manner. And that is very rewarding to do that. but you rarely do get someone at 3 years old. So I recommend any time that there's any problem about the teeth, they should see, if they can perceive that there's a problem. But I think probably no later than 5 years old, I'd like to see all my families who have younger children, and I'm treating the older ones. I ask them to bring them in by 5 years old.
Okay.
Just so we can take a look. And we might not do anything, but we may find something that really, really would help to take care of that so that the person can develop normally from that point on and not have this abnormal situation cause problems that make the treatment more complicated.
Got it.
Later in life.
Got it. So are you saying that the way the first teeth grow or not grow, the way they are positioned and maybe come out or not come out, actually does influence the growth of the permanent and second teeth?
Yes, and there's a lot to that, what you said there, because if a person has a crossbite, that means the back teeth are inside the upper teeth. If that's the situation, the arch, the space for the teeth is made smaller. And if you correct the crossbite, you make more room for the teeth and stop impacted teeth from becoming impacted. The most common tooth that gets impacted in the upper jaw are the cuspids. And the cuspids, the third tooth back from the center.
Oh, has a name, huh?
Those teeth, if they don't have enough room to come in, they grow towards the middle of the mouth and get trapped in back of the front teeth. And then you need surgery to expose the teeth and have the oral surgeon put a hook on the tooth so that I can then direct the tooth into the mouth. And that's a lengthy and probably unnecessary treatment if the person is seen early and the mouth is widened so that doesn't occur.
Okay. So that is one of the reasons why a child should come even if the permanent teeth are not here yet.
Correct. That's right. And at 7 years old, in girls, they may have 4 permanent teeth, 4 in the upper and 4 in the lower, just the front teeth. They've come in at that age. That's the normal time they come in. For boys, they come in at 8 years old. So the girls are a little ahead of the boys, but still.
We know that. We know that.
Yeah, the girls are always ahead.
Okay, good. Well, wonderful. All right. So it's about 7 years old. You have, however, treated 3-year-olds, so that because children, whether they're in whatever kindergarten and they go to preschool and they go to school and 6, 7, 8, 5, and 9. Sometimes we think that they're not self-conscious and that it doesn't matter what they look like because they're not in the dating age yet and stuff. But the truth is probably that that's not true. Probably children are very self-conscious about their smile, and in fact, if they are self-conscious and something is going wrong, it may stick with them, or they may never get rid of it anymore about that self-consciousness, right?
That's an interesting subject. When I ask my patient, why are you coming to see an orthodontist, and they don't answer me, I say, well, then is mom or dad bringing you because they feel something needs to be done for your teeth? Are you just being brought in here and you don't really want to be here? And they'll say, that's right, I don't know what I'm doing here. But they are not truthful, I don't feel, in the majority of the cases, because I will say to them, okay, you're here, we're going to do the examination, I'm going to show you someone who has a condition like yours, and I'll show you how we took care of that and what the teeth ended up looking like after the treatment. And by that time, the patient is ready to start. I mean, they say, okay. But I think they have some apprehension about what is orthodontics entailing, and they may have talked to a younger or a patient who has had orthodontic treatment who likes to scare people, these youngsters. And they say, well, just wait till you get in the orthodontist there and they do this or that. And they like to do that to each other. And so I think some of that goes on. However, I think you're right that the patients have a feeling about themselves and the way they smile. And so that's one of the greatest things.
Even at very young age, because in fact their chances are high that at 5, 6, 7, and 8 you get more heckled than at the age of 30. Nobody heckles anybody about his looks at the age of 30 anymore, but they do that at young age, right?
Yes, we have a lot of foreign people who are here, and their teeth are really, I'd like to treat them, but they don't want to be treated, but they want their children treated. And they just put up with all the spacing and missing teeth and crooked teeth. But they're not interested in doing anything for themselves, and they're not, introverted. They're outgoing and.
Right. Well, that's moms. I mean, my mom, and my dad, they forgo lots of things and have forgone lots of things just to take care of me. I mean, mom will put up with back pain till all hell breaks loose, but she'll bring the little kid for a tiny little scratch to the doctor because the kid shall not have a scar when he grows up or some such thing, whatever it might be. And, that's just the goodness of people who just love to take care of the kids. They say, well, my life is what it is. I can live with it. And, but my kid, I want the best. I want to put any roadblocks into my kid's life,
Yeah, mothers are terrific. And, although the dads don't get credit for some of that, but they make it possible to do all these things.
Right.
So they're in there doing their part, but definitely mothers want their children to have the best.
Right. And my point, starting this conversation, was about the children themselves are self-conscious. Look at those little pretty, beautiful girls, like 4 years old, and they notice a spot on their dress, and they say, Mommy, I want you to change it. You see what I'm saying? Yeah. And
that's right. And in today's world, with all computer and videos and magazines and these things that they look at, and their teeth are not, they don't look like these people on the magazines and on TV. They are concerned about what's going on with them. And they really appreciate that orthodontics can take care of things for them.
Well, thanks a lot, Dr. Stepovich. That was, it was good information. And I hope that it is useful for the patients out there. The moms. Children are self-confident, and even though they lose their teeth, but, that's 2, 3, or 4 years where you just don't want to put them through the grinder if something maybe can be done to straighten them out right there and then. And very importantly, to make sure that the second set of teeth comes in as good as possible. It can be. That's why you should go to an orthodontist soon, early. Bye-bye.